Lakshmi, we can start now.
Okay, thank you. Remember, over to you.
Good morning, one and all. As said by Thich Nhat Hanh, because of your smile, you make life more beautiful. Indian Pharmacy Graduate Association Women's Forum, Kerala, is celebrating Tooth Fairy Day on August 21st with a lot of excitement and wonder of kids losing their teeth. National Tooth Fairy Day is a reminder for kids, young and old, to relive the fun of visits from the Tooth Fairy when a newly lost teeth was exchanged for a fun surprise as they looked under their pillow in the morning. Myself, Mrs. Ramya Gayatri, Assistant Professor, Department of Pharmacy Practice, Chemist College of Pharmaceutical Sciences and Research, Ernakulam. Respected fellow pharma community and participants from other streams, we are here for the Tooth Fairy Day celebration organized by IPGA Women's Forum. Welcome one and all to the World Tooth Fairy Day celebration 2022. Let's start with prayer song for seeking blessings from Almighty. Now, let's move to our program. It is my privilege to invite Dr. Limsi Thambi, Professor and Head, Department of Pharmaceutics, Chemist College of Pharmaceutical Sciences and Research, Ernakulam, for the welcome address.
Thank you, Ramya. Am I audible?
Yes, ma'am.
Honorable guests, respected speakers of today's scientific session, coordinators, and all the delegates present here, a warm good morning to one and all. Thank you to each and everyone of being here with us today. I am much honored to welcome you to this national webinar on the topic Shining Teeth for Smiling Face, organized by IPJ Women's Forum. IPJ Women's Forum Kerala branch organizes seminars consistently for pharma aspirants to gain information and to be effectively associated with our curriculum. It is indeed honor and privilege to welcome Dr. Satish Kumar CH, IPJ Kerala State President, to this event to grace the occasion. On behalf of IPJ Women's Forum, I welcome Dr. Sanju Devan, Director of Research and Development, Baxter Pharmaceuticals, Ahmedabad, Gujarat, for taking her time off a busy schedule to be a part of this program. It's honor for us that she has been part of this important time for joining this event. It's my pleasure to extend gracious and inclusive welcome our most renowned resource persons of the scientific event, Dr. Ashna PA and Dr. Fousiya, for accepting our invitation to share his valuable knowledge about the topic. I am very much pleased to welcome Dr. Mahalakshmi R, IPJ Women's Forum Coordinator of Kerala State Branch, for rendering her support to this event as well as her contribution towards the success of this event. I also welcome Mrs. Ramya Gayatri, Assistant Professor, Department of Pharmacy Practice, CPSR, and IPG Life member for moderating this session. I also welcome Mrs. Gladys Kachapalli for proposing the vote of thanks. I ensure the seminar will be profitable and next few hours will be fruitful for every one of you. So let us appreciate the efforts of all the teams of IPG Women's Forum, Kerala State, for working hard to make this event a grand success. Thank you. Thank you once again.
Thank you, ma'am. It is my privilege to invite Dr. Satish Kumar Manan, President, IPGA Kerala State Branch, a real sculpture of humanity, to enlighten us with your words here. Dr. Satish Kumar Manan is a retired drug controller of Kerala State with 30 years of meritorious experience in regulatory affairs. Presently, Dr. Satish is working as Head, Business Development, Agape Diagnostics Limited, Cochin, a leading in vitro diagnostics, equipment and reagent manufacturing company from Kerala. He is a postgraduate in pharmacy and honored with PhD as well as LLB. He is an active member and office bearer of various professional bodies, including former president of KPGA, Kerala State Drugs Control Enforcement Officers Association, and so on. I welcome you, sir, to address the gathering. Over to you, sir.
Thank you, Ramya. Good morning, everybody. Good morning. Dear Dr. Sanju Dhawanji, Dr. Mahalakshmi, Dr. Ashna, Dr. Fousiya, and my dear Women's Forum members, invited guests, fellow pharmacists, and my friends. It's a privilege for me to address this august audience on this World Fairy Day for the national seminar with the title "With the Shine Teeth for Smiling Face," organized by a Women's Forum IPJ Kerala in association with the Futurice Hospital Cochin. Still, I feel the audience number is a bit low lean today, Mahalakshmi. However, I think it's a Sunday. I think so. Let us recognize the important role of the tooth fairy that plays in ensuring the kids and next generation of our people to know more important how dental hygiene is. In fact, the fairy day was a new news to me also. In fact, yes, globally, about 3.5 billion people are affected with the oral diseases as per the reports. In India, 32% of males and 34% of females are also suffering from dental disorders as per the reports. In children also in India, it's more affected. It's what I heard. Around 55% of our children community are suffering from this dental caries as per the reports I have verified yesterday. So let us spread this information to as many people and young generation as we can to motivate them to care for their mouths and uphold their standard of living for a better day ahead. An unhealthy mouth not only impacts general health, but it can have a severe impact on their emotional, social, mental, and overall physical well-being. And that's why we are calling on people to be proud of their mouth for their happiness and well-being, sure. So it is 100% true that oral health is vital for our happiness and well-being. The good news is that our oral health can be maintained perfectly by being aware of your risk factors and taking a bit of care. So let me congratulate Women's Forum in organizing this awareness talk titled "Shine Teeth for Smiling Face" in association with the Futurice Hospital Cochin. Thank you all the organizers. Thank you so much.
Thank you, sir. It is my great pleasure to invite Dr. Sanju Dhawan, Director of Research and Development, Baxter Pharmaceuticals Incorporated, Ahmedabad, Gujarat, who deserves a special recognition in this event. Dr. Sanju Dhawan is heading the Indian Research and Development Unit of Baxter Incorporated. She is one of the Board of Directors and Governance Council of Baxter Pharmaceuticals India Private Limited. She is a seasoned R&D leader with over 26 years of experience in new product development of generics, complex generics, and novel drug delivery systems, well known for her product development skills. Dr. Sanju is an inspiring, resilient, courageous, decisive, and focused leader with 12 patents to her credit. Prior to Baxter, Dr. Sanju has worked with well-known companies including Pfizer Healthcare India, Cadila Pharmaceuticals, Dr. Reddy's, and Panacea Biotech Limited. She has a blend of industry and academia experience and has authored 4 book chapters as well as 39 journal articles. Academically, Sanju holds a PhD in pharmaceutical sciences and a master's degree in pharmaceutics. A self-motivated professional, Dr. Sanju is dedicated to embrace compliance, data integrity, and drive teams towards a quality culture. Sanju believes in leaving behind a legacy and living with a purpose of making positive impact on human life. She believes in giving back to society and profession. Over to you, ma'am.
First of all, good morning, everyone, whosoever is there on this webinar. And thank you, Ramya, for those kind words. And I want to take on to Dr. Satish, who had set up the context very well, that oral health, dental health is very, very important almost at every stage. And he mentioned some of the data. So I really want to thank first Mahalakshmi, Kerala state branch of IPGA, having me on this webinar as a chief guest. And I really want to applaud the efforts of Mahalakshmi, who has been doing consistently those kind of webinars for the benefit of masses consistently throughout last 2 years. And I have seen her perseverance, that even if, we have a smaller crowd on the webinar, but she wants to continue her efforts. So kudos to her. And it is not only her, but her team as well. And I'm aware of that Limsy and Ramya, many other team members are there, Gladys, many others are there who are in the team, who really put in a lot of efforts prior to such kind of events, because you are not able to do these events in a day or so. So again, I really want to applaud the efforts of Dr. Satish, Shri Dilip, as well as Dr. Nishit, because they have been consistently working towards the objectives of IPGA. I know that yesterday they rolled out. They really want to, say thanks to Dr. Ashna and Dr. Fousiya, who took out time and are there for helping IPGA to achieve their objectives. And the topic is very apt. Tooth Fairy Day, as Dr. Satish said, that even I was not aware of all this Tooth Fairy Day, and that the topic is really apt, that shining teeth for smiling face. And teeth is not something new for any one of us. If you see, we have all gone through our own lives, and people like me who have children, or all those people who have got their children, they have seen, tooth pushing through the gums at the 6 months of age. So when a child is about 6 months old, the teeth come out of the gums, and then what happens, that child has got some of the irritating ability and many other things we have seen. From 6 months to 2 years, those incisors, canine, and the child has got milk teeth, which are about 20 in number. And after 2 years, then when the child reaches the age of 6 years, they lose that teeth basically. And then losing the teeth is sometimes a smooth experience for some children, but it may not be a smooth experience for other children as well. So from 6 to 12, then a child who had 20 teeth, which were milk teeth, now are removed from the gums. They get loosened from the gums, and the new adult teeth appear from 6 years to 12 years. So children enter teenage at the age of 13 with about 28. And then when we are around, 25 or late 20s or early 30s, then those 4 wisdom tooth appear. And not necessarily that everyone will have that 4 wisdom tooth or not. And sometimes, they remain inside. And I remember that my mother used to tell me that when you get wisdom tooth, your wisdom enhances. I'm not sure how much, whether that is a fact, that is a myth or what, but I think we have seen this cycle. And then I have seen that when you become 50, it becomes essential for you to take care of your teeth, because they are now, decades old, and they require cleaning and many other things, and then people say that the more teeth you have in your mouth, longer is the life. That's what I have heard many people and many elders saying. So having said that, we all have gone through the cycle of through this, but still see our knowledge about Tooth Fairy Day is limited one, because when Mahalakshmi sent the invite to me, I too went to Google to see, what exactly it is. And Dr. Satish, just very rightly mentioned that, what exactly it is, that when people when children lose their tooth, they feel sad. But when they find that gift under their pillow, which comes from a fairy, we all know that those fairies, they bring, good things for us. Santa Claus, fairies, they all bring good things for us. And I remember in my times and our children's times, we did not keep their tooth, while the expectation today is that you preserve your milk teeth. And then at one point of time, you see the history and background that, these were your milk teeth. And this is a general process of life, that you will lose your teeth and you will have new teeth, which will be coming up at the adult age or at the teenage, basically. So I think the very well topic, Tooth Fairy Day, to enhance the awareness about the dental hygiene, about our teeth, about many of the events which happen in our life because of this. And personally, over the years, I have seen dentistry evolved a lot. And I remember the times when, there were cavities. At that point of time, the cavities were filled with silver and gold. And I've seen people whose tooth were not there. The people used to have golden tooth, which looked like an artificial tooth. But nowadays, if you see, if you have cavities, basically, many of the root canal procedures are there. And then crowns are there. Those crowns, different materials are there. Zirconium is the one which was the latest, longest life. And then, nowadays, when you go to the dentist, they also tell which color of the tooth matches with your original teeth colors, and then they put that thing. I see that the equipment has evolved, technology has evolved. And nowadays, even if at the old age you don't have your gum bone over there, they will graft the bone and then they will implant. So there are many things which are there scientifically. The dentistry has evolved a lot. So lot has been there over the years and over the decades. So thank you, Mahalakshmi, for raising this awareness and making this whole masses aware of all these topics. And at the end, I really want to say that smile is the most inexpensive gift that one can bestow on anyone. But smile has got huge powers. It not only enhances your visual appearance, but it also gives you a positive mindset, and it gives you healthy mouth and healthy body. You would have seen, there were earlier times, if you look at the pictures of people, you will see they were all mouths closed, they never used to show their teeth. But if you look at today's selfies and today's pictures onto the Facebook, everyone wants to smile. So life is short, and smile as long as you have teeth. This was an old saying, but I want to say that even if today you don't have a teeth, you please go to dentist, have those it's objective is to sustain those original teeth for a long period of time, as long as possible. But then it is also that utilize these technologies, utilize the science to have those crowns. If your original teeth are not working well, have those dental implants and many other things, and then smile as long as you are alive. And I really want to thank IPGA for raising this awareness, and not only for the members of IPGA, but also for other masses as well. And request to all people who are there, try to enhance the number of IPGA members with us. And thank you very much, IPGA Women Forum team. Kudos to all the team. With that, I will hand over to Ramya again, and look forward to hear from the recommendations of those two speakers who are there in this webinar. Thank you.
Thank you, ma'am. Next, I invite Dr. Ashna PA for sharing her knowledge and experiences based on the theme, Shining Teeth for Smiling Face. Dr. Ashna, a personality with positive attitude, good administrative and management skills, and passionate counselor. She also provides career guidance to budding professionals. She was the editor of College Magazine, The Pencil, and coordinator of hospitality management during cultural events. She is an active participant in public health dentistry campaigns and also conducts counseling programs for geriatric patients and about dental surgery in Live Doctor, a program telecasted in News 24 channel. Over to you, Dr. Ashna.
Thank you, Ramya madam. Good morning, everyone. Let me thank Mahalakshmi madam for such a beautiful crowd. I thank Indian Pharmacy Graduates Association, Women's Forum Kerala, Satish Kumar Manan sir, Sanju Dhawan madam, Limsi Tampi ma'am, Ramya Gayatri ma'am. I thank all of you. It's a great privilege and honor to be here and do a webinar on this topic. So we all know what is the importance of smile, right? Smile is a curve which sets everything straight, right? I'm a mother of 4 kids. Let me tell you a story. Like my younger daughter, who is 5.5 years old, just 1 week back, like rest of the thing in the world, she believes that she's the best. She's the most prettiest girl in the world. Okay. And one day she came to me, Mama, I lost my teeth. Can you give a new teeth? So imagine like a child without a teeth telling her problem. She has, usually she doesn't bother me for anything else. But that day she was shook. She was a small girl. For her, that was her world. She lost her tooth and she couldn't bear it. Okay. So that's why I told you that tooth fairy story. At least for some time or for some people, it's always stories are stories. Yet it become what to say, it becomes a very good solace for kids. So happy National Tooth Fairy Day, everyone. Let me begin. Can you please share the screen, ma'am?
You can share.
So meanwhile, I'll be just continuing. Okay. So I want an interactive session. Like, why do we need teeth? Can we have few interactions?
Yes, ma'am. Yes, carry on. Just wait for silence. Email you carry on.
Yes, yes. So can you unmute and say, why do we need teeth?
For feeding ourselves, for eating.
Good. Yes. So we say like, anyway, we want to have food 3 times a day. So essentially we need teeth, right? So for chewing and digestion of food, to make it into small bolus, it's very, very important. If we don't chew it properly, our digestion also won't be proper. Yes, exactly. Then what else?
For a beautiful smile.
Definitely. Whatever you say, let it be a small girl or small child or a bigger person or even a geriatric one, an old lady. Everyone wants a beautiful smile. Who doesn't want a beautiful smile, right? So everyone is concerned. But basically, younger people are more concerned about their appearance, whereas older generation are more concerned about the function. Okay, so that's the second thing. So we all are obsessed with our beauty, smile, and all. So it's very important that we should have a beautiful smile. We should be happy. We should be confident. So the smile also matters. Okay, and anything else? Second slide, please. Okay. So the third thing is we have to speak clearly, right? In movies and all, you might have seen people having some speech issues and all. So no one wants that. Okay. So we want to speak with clarity. We want to communicate. Let it be any profession. Our phonetics is very, very important. Imagine a teacher or a preacher or a singer or a politician who is having a lost front teeth. Imagine the situation. Will they be confident enough? No, right? Okay, so teeth is very, very important. Next slide, please. Okay, so what are the common oral problems which are faced by humans? So basically, we all know that, like, when you remember, when you think of a dentist, what do you first comes into your mind? Decay, right? Caries. So caries is the first problem, which is the most common disease of the oral cavity. Second comes the calculus. What is a calculi? Calculus means the food deposits, no, it gets calcified and form a hard layer over the surface of the teeth. That is called the calculus. So even if we brush properly twice a day, there might be few deposits which is remaining. That's why we insist to see a dental surgeon, dentist every 6 months. So that is very important. So professional as well as personal care is equally important. So next is gingivitis. So most of you might have experienced at some time of your life, a bleeding while brushing, or for your kids or somebody else. Okay, there might be a bleeding while brushing. That is an indication of gingivitis. That is the inflammation of gums. Now, next is periodontitis. Periodontitis means it's a severe form of gingivitis. Gingivitis, what is the difference between gingivitis and periodontitis? Gingivitis is the starting stage. Okay, when you have a bleeding from the gum or a slightly swollen gum or a red colored gum, that is called gingivitis. And the main difference is that gingivitis, it is a reversible condition. If you take care properly, you go for a professional help, you do a cleaning, then it reverses. That is gingivitis. Then periodontitis. Periodontitis means it's a little advanced stage of gingivitis. There you won't take enough care. What happens is it becomes more severe and there will be recession of your gums. There can be severe sensitivity of your teeth. There can be looseness of your teeth, and ultimately there are high chances that your tooth may fall off. So it is a irreversible condition. Why it becomes irreversible is that there will be some problem, loss of your bone. Along with the problem with the teeth, there will be problem with the surrounding bone. So that is why it becomes a little more fatal. Okay, so that is the difference between gingivitis and periodontitis. Now, next is bad breath. So most of the people, we don't like, we always want a good smelling mouth, right? That is why we always try to improve our oral hygiene whatever possible ways. But still, there are some factors, not only because of oral factors, there are so many other factors which can cause bad breath. I'll come to that later. Okay, then another problem is sensitivity. Sometimes you might be very wanting to have an ice cream or a very hot fudge or something, but most of the times you may not be able to eat your food properly because of the sensitivity of the tooth. It can be for a single tooth or it can be generalized. So why this is happening? What are the reasons for that? So we will come to that. Okay, next slide. So before I told you, teeth decay or cavity is one of the major problems regarding oral cavity. How is this cavity formed, or how the teeth is getting decayed? What is a caries? Basically, caries is a permanently damaged area in the hard surface of your teeth. And why is this caries happening? So it is basically due to a combination of certain factors. That is bacteria in your mouth. That is one thing. There are plenty of bacteria in your mouth, but basically cariogenic bacteria, the prime cause is Streptococcus mutans. Okay, and another reason is frequent snacking. Some people have a habit of frequent snacking. Some people, they'll be having food on only on regular 3 times or 4 times like that. But few people are so obsessed with frequent snacking. So that is one of the main reasons for causing caries. Now, another reason is some people won't be having snacking at times, but they will be sipping sugary drinks. That is again one of the main problem for causing dental decay. And again, another thing is not cleaning your teeth well. Some people will not be so bothered about having a frequent food or frequent sipping sugary fluids and all, but they won't be cleaning the oral cavity properly. Majority of the people who come to my clinic, I ask them, how many times do you brush? They'll tell one time. How much ever we educate, still also that is not changing. But in school levels and all, we can see a major change they are trying to do. But if you check with the adult population, it's still a little lacking thing. Okay, so basically this cariogenic bacteria, especially the Streptococcus mutans, these metabolizes sugars or carbs, and this produces acids. And this acids, this will demineralize the tooth structure. The hard tooth structure is demineralized, and that is how decay is formed. For a prolonged period of time, when there is demineralization, what happens is that it ultimately results in a dental decay. So this is the process. Next slide, please. So what are the various stages of the progress of a caries or progress of a decay? So in a broader sense, if you examine, teeth has got basically 3 layers. We all know the outer covering of the teeth, that is the white colored portion, which is the hardest substance of our body, that is enamel. Okay. And the second layer is the dentin, the yellow colored structure, which is the majority portion of our teeth. And the inner core is the pulp, which contains the blood vessels, nerves, and everything. And imagine you have a dental decay or caries at the enamel level. If you go to a dentist, it may come as a pit or it may be seen as a fissure on the topmost layer of the teeth. If you correct it on the spot, it's very easy to correct. But if you leave just like that, see, I don't have any pain, I don't have any sensitivity, so let me take some more time. It's not an emergency. If you keep it like that, what happens? It will progress to the second layer, that is the dentin. Dentin means it's a little inside. It contains more of organic material than enamel means more of inorganic substance, whereas dentin means more of organic substance. So what happens? This progress is little more faster. So what happens is you might get sensitivity, but still, even if you get sensitivity, majority of the people will ignore it. That is when it goes to the next layer, that is the pulp. Once this pulp gets infected, the story starts. You will get pain. That is the time majority of people go to a dentist for a treatment. But what is the use? Most of the time, that tooth might have lost its vitality. It's dead. So what we can do, we cannot do a filling because already the tooth is dead. So we will have to go ahead with the root canal therapy. Is that enough? Is a root canal enough? No. Most of the times when you do a root canal treatment, we are taking out all these dead tissues, everything. We are cleaning and shaping, and almost 50% of the tooth structure is lost due to a root canal therapy. And crown structure, sometimes some people will be having a good enough crown portion remaining, but still majority of the times, once you go to the dentist, most of the crown structure must have been lost. So if we just do a root canal therapy and leave it like that, what happens is that on a long go, high chances are there that it may just get brittle and you will lose that teeth. So majority of times after doing a root canal therapy, it's mandatory to go for a crown. Nowadays, there are various alternatives for crowns, but in most of the cases, it won't be the thing because when you come, majority of the tooth structure is lost. If it is not that much lost, we can do another alternative treatment like inlays, onlays, etc. It all depends upon the remaining structure of the teeth. Okay, so that is regarding pulpitis and pulpal issues. Imagine you are having a pulpitis or a pulpal issue. So what you will do, you will take some, maybe you will take some analgesic, or at the max, you might take an antibiotic course. You will get, you will feel relieved for some time. then you will think, okay, now I'm feeling quite okay. Then what is the point to go to a dentist? Maybe next time, if it gets worse, I'll go and visit my dentist. So what happens? Has the infection stopped there? No. What happens? It will go to the next level in a very chronic way. So you might get a periapical issue down the teeth, down the root. It may spread to the bone. You might get an abscess. Then again, you might get a loose teeth. Again, the problem worsens. So majority of the times, patient will come to you because of the periapical problem. And again, gum issues, it can lead to periodontitis. Periodontitis means gum issue, the inflammation of the gum and the surrounding bones and all things. Okay. Next slide, please. So we have plenty of options. If it is a very small decay, we can just fill it with tooth-colored materials. Like many years ago, we had amalgam fillings which contained mercury. But nowadays, majority of the places, we have tooth-colored fillings like GIC restoration, composite restorations, and so many other things are there. So tooth-colored fillings are the most common things what you can do for a dental decay. Now, if it comes to the, if it goes beyond, if it goes to the pulp or the other layers, what we can do is, only option is root canal treatment or removal of the teeth. But removal of a teeth is the last resort until and unless it is a wisdom tooth. Wisdom tooth means, last time I heard madam telling about wisdom teeth. So wisdom teeth regarding, it's a vestigial organ, actually speaking. If you don't have wisdom tooth also, it doesn't matter with the bite. So except these wisdom teeth, whichever teeth, if you have a cavity or any like severe decay, it's most appropriate to go to a dentist and get the filling done or root canal therapy done. Worst scenario, if you cannot replace it, then only we will advise extraction of that teeth. Next slide, please. Now, next common problem is gum disease. So next to the dental decay, the main problem which affects our oral cavity is a gum disease. So I already told you, you might have noticed very swollen gums or red colored gum, or there might be bleeding from the gum. So these are the common things which you can come across while seeing a gum issue. Okay, why this is happening? Majority of the time, it may be due to poor oral hygiene. Sometimes you might be doing your brushing twice a day. Then what might be wrong? It might be your brushing technique. There are various brushing techniques, but there are very acceptable types of doing brushing. And for some people, like front portion, inside and all, everything will be clear. They'll be doing proper technique, but still they'll be having decay. What might be the reason? Any idea? Even they clean it twice a day, or even if they do the correct technique, still there might be a problem. There might be a decay. There might be some other infection. Why? It may be because they are not flossing. Flossing is again another technique which you have to follow. So there may be decay in between the teeth. Brushing and all might be right, but still in between the teeth, there are high chances that you might get a decay. So again, coming to the gum disease. So if you have not cleaned it properly, this plaque, this biofilm which is occurring, it will adhere to the junction between the gum and the teeth. And there, slowly it gets calcified and forms a calculus layer. Even if you brush how many times, most of the people, the problem is that they will try to get rid of that calculus. They will use hard bristle toothbrushes and brush very hardly. But what happens ultimately is they'll be ending up with severe teeth sensitivity. They will lose the enamel layer on the top because of the severe brushing. Maybe they'll brush for 10-15 minutes, etc., trying to remove all these calculus. But what happens is that ultimately they will lose the enamel. So what is the ideal time for brushing? Any idea? How much time you have to spend for your brushing? I have seen people doing it for 10-15 minutes, very intensely brushing. Is it the correct way? No, you just have to do You just have to spend 2 minutes. Yes, exactly. 2 minutes in the morning, 2 minutes at night after having your food before going to bed. But the technique should be proper. Flossing should be done. Then majority of the time, there won't be an issue. And suppose you are not able to remove that. It has gone to that calculi level. What you have to do, you have to take a professional help. Every 6 months, I will say it's mandatory to visit a dentist so that whichever portion you cannot clean by yourself, even if doing the proper brushing, proper flossing, everything, you can take the professional help. So there comes the role of a dentist. Okay. And regarding this gum disease, as I mentioned earlier, there is gingivitis as well as periodontitis. If you clean it appropriately on time, it won't go to the next level, that is periodontitis, which affects the bone. Next slide, please. So these are the various methods of oral hygiene. First is brushing. Dr. Fousiya will be explaining the brushing techniques later. So you have to brush twice daily using proper brush. And see, some people will be having severe sensitivity. So what kind of toothbrushes they have to use? Any idea? Is it the same brush you have to use when you are having sensitivity? Basically, there are 3 types of bristles, ultra soft. Okay. There are basically 3 types of bristled ones. Others, okay, soft, ultra soft, and all things comes under soft only. So basically, there is a hard bristled one, then medium bristled one, and soft bristled one. So ideally, it's always good to have a soft bristled one. And for some people, they'll say it's very extremely difficult. The calculus is not going and all. And if the tooth structure is intact and all, medium or soft bristle one you can use, no problem. But never go for a hard bristle toothbrush. There are high chances that the enamel will worn off. Okay. And second thing is, how frequently you have to change your brush? Every month, every 2 months, 3 months, 6 months, 1 year? Okay, got an answer, 2 months. Every 3 months, you can go up to 3 months, no issues. But better than that, I'll give you another scale, how to know when you have to change your brush. Okay, that is, you just look at the bristles of your brush. If the flare of the toothbrush is more than 50%, then that is most likely that you have to change your teeth. More than 2 months or 3 months, if your brush has, some people will be having some busy routine or something, so they will be doing some vigorous motion, and the flare of the bristles might be a little more. So it's always better you check the flare of your bristles. If it is more than 50%, it's always likely you change your brush. Okay, what will happen if you use a toothbrush with the bristles which has a wide flare? What will happen? Any idea? Okay, if you use a teeth with a very hard flare, or which has more than 50% of flare, it is more likely that you will get recession of your gums. Your gum level, no, like everyone has a gum level, right? Like your teeth, you will have a position of your gum, and that position of your gum should be maintained. If it goes beyond, no, that is called gingival recession. So that is again a problem with your gum tissue. It's your supporting structure, right? Gum is your supporting structure. So when it recedes, the problem is that the root of your tooth will get exposed. Then again, it's a sequelae. It will lead to another one, and next level like that. So it's always better. You should know when to change your brush. Okay. And another thing is mouthwash. Do everyone has to use mouthwash daily? Any idea? People with gum disease, they definitely have to go to a dentist, and they will have to use the mouthwashes according to doctor's prescription, because not like every cases won't be same. It varies from person to person. So sometimes patients have to take a concentrated version of your mouthwash, and in some cases we will have to dilute it. So better you always take the opinion of the dentist and go ahead with the mouthwashes. And more like use of mouthwash for a long time, not every mouthwashes, some mouthwashes, it has the problem of staining. So selection of mouthwash is also important. So Dr. Fousiya will be dealing with all things. And another thing is flossing. So is brushing and mouthwash enough? No. Flossing is also very, very important, because in between the teeth, how much ever you brush beautifully, still there are chances that like there will be some problem with the interdental spaces. For some people, that contact between two teeth will be very tight. But for some people, there will be spaces between the teeth. Then again, food might get lodged in between these teeth, and there are high chances that it may get decayed. So flossing is again very, very important. Next slide, please. Now coming to bad breath. Okay. So how many of you think that bad breath is only due to oral issues, or can it be due to some other issues? Definitely, we know that there are various other issues. Basically, when you don't clean your teeth properly, bacteria will build up in your mouth, not only in the teeth, tongue as well. That is why tongue cleaning is also very, very important. If your tongue is coated with bacteria and all, again, you will have problem with the bad breath. Now, because of gingivitis, as I mentioned earlier, that is another cause of bad breath. Then again, cavities. Because of cavities also, you may get a bad breath. Then smoking, chronic smokers and all, it's very difficult to, even after cleaning also, it's very difficult to get that breath back. So it takes some time. And again, some people have the habit of using foods of having strong odors. That is again a cause. Now, these are the basic problems from the oral cavity. Now, let's check other causes which causes bad breath. One is tonsillitis. One of the major causes is tonsillitis, especially if you see kids and all, you know it. Now, another is sinus condition. Because of sinusitis and all, yet again, you might get a bad breath. It's otherwise known as halitosis. Okay, bad breath is otherwise known as halitosis. And yet another problem. And some people, even after cleaning, professional cleaning, they might not be able to get rid of the bad breath. That might be because of some digestive issues, ulcers and all. Then another problem is lung disease, like COPDs and all. These people, how much ever they try to maintain oral hygiene, still that smell remains the same. So this is basically due to lung disease. And few people will be having constipation. Because of that, they'll be getting bad breath. So finding out the correct cause of the problem is the main thing. So we have to find out, is it due to a dental problem or some other problem, and correcting it. That is the way we deal with the corrections. Next slide, please. Now, another problem is tooth sensitivity. So it can be due to some sweet foods like candies, some fruits and veggies, or it can be due to some acidic foods like lemons, tomatoes, vinegar, etc. And sometimes it can be due to hot, cold foods, drinks like tea, coffee, ice water, soda, etc. So because of all these food, tooth may get severe sensitivity. So if you're having a sensitivity issue, what has to be done? You can visit your dentist and find out, like, is there any erosion or abrasion or any attrition? So these are the terminologies we commonly use. Attrition means like usually the enamel will be lost from the inner surface. Abrasion means usually it will be the tooth loss or enamel loss will be from the side of the teeth. And sometimes there may be erosion. Erosion usually is due to, if you have a gastric issue or something, gastric regurgitation of the acids, it affects the teeth and causes erosion. So first we have to find out what is the reason behind that, or any other issues are there. So first find out and we'll try to sort it out. Sometimes few abrasions and all, even if you use desensitizing toothpaste, it won't give you any solace. Why? Because a lot of enamel structure has been lost. You might have to go for a filling. Then only you can correct it. And in certain conditions, even filling cannot be a treatment, because sometimes that pulp of those teeth might have got exposed. In such conditions, you will have to go for a root canal therapy. Then you will have to go for a crown and all. So we have to see what is the problem. Why there is tooth sensitivity, or sometimes it may be due to generalized sensitivity because of gum issues. So first, let us find out the cause, then we will treat accordingly. Next slide, please. So we have various desensitizing toothpaste available in the market. So let's find out the condition. Will this suffice to this problem? Then we can go ahead with the toothpaste. Otherwise, you will have to go for it, filling or root canal therapy, crown, or whatever it is. So we have to find out the course. Next slide, please. Now, another problem we most commonly face is unattractive smile. So majority of us, like all of us, I would say, wants a beautiful smile, right? So what are the main problem with the malaligned tooth? Like what are the conditions where you get a crooked or malaligned tooth? One is crowding, of course, crowding. Another thing is proclination, severe proclination. It can be only for the upper teeth, or it may be due to lower teeth, or it can be from both the teeth. Okay. Another thing is spacing. Spacing is also again a very frequent issue. So spacing, crowding, then proclination. These are the common things where you can see malaligned teeth. So for that, we have various alternatives in orthodontics. Orthodontics means doing the braces or aligners. So recently we have aligner therapy that is like, it's called clear aligner. That is one of the magic wand, I would say, because you don't have to go ahead with braces for correcting your smile. It's like a plastic sheet which you can place in your mouth, and there will be various set of trays which is available in the market. So you can use this every 2 weeks. You can change it until you get the correct smile. According to your orthodontist, you can correct it. And every month you don't have to go and tighten your brackets. And because of that, it's such a big boon. Next slide, please. Now coming to the cosmetic dentistry. I love the subject because I'm a cosmetic dentist too. And most of the time people will be coming to you for a Hollywood smile, Bollywood smile. What is it all about? Have you heard about Hollywood smile, Bollywood smile and all? You want to look like Kareena Kapoor, you want to look like Alia Bhatt smile, right? So what is this all about? So veneers, I would say laminate veneers. Sometimes you won't be happy with the color of your teeth, right? Color, little yellowish. I'm not looking good. Yellow teeth, what is it all about? Now, I'm not happy with the shape of my teeth. I want to change the shape of my teeth. It's not looking like Kareena Kapoor teeth. Now, or maybe I'm not happy with the size of my teeth. I'm having a very big face and very small teeth. Or some people, it will be vice versa. Very small face, very big teeth. How can we correct it? There comes the role of cosmetic dentistry. So we have veneers, laminate veneers and crowns. Laminate veneers means it's a very thin layer which we can, it's like a gum-like thing can be attached to the teeth. It's an adhesive resin, which using this, we can just fix these veneers, okay? And in case of severe proclination and all, ideally it's always orthodontic therapy. If not, because of some other reasons, we can go ahead with crowns. Now, another problem is like sometimes with a small change in the shape of your teeth, you can make a beautiful smile, but in a very limited way. If you grind your teeth a lot, you will get severe sensitivity. Mild corrections and all, you can go ahead with this enameloplasty, that is changing the contour of the teeth. Now, another thing is gingivectomy. That means suppose your gum, you're not happy with the shape of your gum, or there might be some inflammatory, like oversized gums. Teeth are very small and gum is little like a little over the teeth. In such conditions, what you can do is you can go ahead with the gingivectomy. You can shape your gums. That is called gingivectomy. Now, another thing is like, I'm not happy with the color of my teeth. Doctor, what can you do? Majority of the times you'll be facing this issue. So can a normal cleaning enhance the color of your teeth? Very your color cannot be changed due to a scaling. I mean, oral prophylaxis or cleaning cannot change the color of your teeth. To some extent, doing a mild polishing can do a very minute change, but still a bleaching or tooth whitening is the procedure where you can change the color of your teeth. But is it a permanent solution? No, it might last for 8 to 10 months or maximum 1 year, but that is not a permanent solution. Most of the times, a groom or a bride or a person who is going to attend a function, that is when usually people will come to you and ask for a tooth whitening. But now the time has changed. if you are not confident enough to face this thing, people are coming for tooth whitening and all. And I would say laser is one of the best tools for doing tooth whitening. And believe me, the sensitivity issues are very less when you go ahead with a laser tooth whitening. And if you want a permanent solution, it is the veneers or crowns which can give you the proper color of your teeth. Like Madam already before said, we have various shade tabs. You can choose which color you want for your teeth. There are many people coming from abroad. They just want, what we usually try to do is, we will try to match it with the color of the adjacent teeth. But majority of the time, people from abroad, they want like very white teeth. They will ask us, which is the most white teeth in this your shade. They will select it and they will do the whitening like that. Okay, there is a question, does tooth whitening is bad for our teeth? Actually speaking, we have to check the condition of your teeth. If you're having a sensitivity issue, it is not advisable to go for a tooth whitening. If your teeth is healthy enough, there is no problem. It's like when you go for your bleaching of your face and all, no? Like it's the same thing. You're using peroxide here. It's anyway, it's a chemical thing. For your face also, you will do the bleaching, no? Like that only for teeth. In certain conditions, there are specific contraindications like sensitivity of the teeth. In such conditions, we'll tell the patient better not to do. So other than that, it's quite fine. And next is gum depigmentation. Like the teeth, some people come to you with a dark gum. You might have noticed the tooth will be very white. There is no problem with the teeth color, but the gum color will be very dark or pigmented. So what can we do for such patients? Any idea? It is the gum depigmentation. There are two methods for doing gum depigmentation. That is like using a scalpel. It's a mild surgical procedure, but good and latest one is laser depigmentation. Like there won't be any bleeding, there won't be any hazels for laser depigmentation. You will get a very good correction of your gum color. That is gum depigmentation. Next slide, please. So that is veneer and crown. You can see a very thin layer. So this is the crown, veneer and crown. Next slide, please. So before I said no enameloplasty, in the first photo, you can see there are some problem with the shape of the teeth. So that is corrected by just doing a small correction. That is enameloplasty. Next slide. Gingivectomy. Here you can see in the first photo that the gum has gone beyond and the shape of the gum is not good. So that is the only reason it might be looking so weird. So we can correct it using we will first do the measurements and all, and we will cut the gum and make a good shape for the gum. That is called gingivectomy. Next slide. Next is teeth whitening or laser whitening. So it can give it can maybe up to 4 shades higher or 4 shades brighter smile you can get using whitening procedures. Even if it is laser or without laser, you will get the result. But laser is always good. Next slide, please. Now, so this is the gum depigmentation I mentioned before. You can see a very pigmented gum here. After doing depigmentation, this is the result. Next slide, please. Now, coming to the loss of tooth. How do we lose tooth? It may be due to an accident or trauma. It can be due to a decay, a gum disease. And there are some conditions where people are born without teeth or less number of teeth. And there may be some medical conditions where we lose our teeth. Next slide, please. So what happens when you lose a permanent teeth? Baby teeth, Dr. Fousiya will be taking. And regarding the permanent teeth, you know, once permanent tooth is lost, there won't be formation of new teeth, right? So you'll be having difficulty in chewing food, aesthetics. Definitely aesthetics is a problem, lowered self-esteem. It will affect you psychologically very much. And there will be altered bite, there will be loss of bone, and there will be weakened jaw muscles. There will be sagging of your skin. You will look old. So all these are problems when you lose your teeth, right? Next slide, please. Now, what are the options for replacing a missing teeth? Basically, we have 2 options, removable one and fixed one. Removable, you might have seen your grannies wearing full set of dentures and all. So that is one thing, old one. Now, most of the people have changed to fixed options. Okay. Now, if one teeth is missing, we can replace it using a bridge, that is taking support of the other two adjacent teeth as in this picture. And this is called a bridge. We can just fix it permanently. But the problem here is that bone loss cannot be prevented. But still for 10, 15 years and all, bridge is a very good option. Any other alternative? Next slide, please. It's the dental implant. This is one of the best options available. But for that, you should have a sound quality and quantity of the bone. Dental implant is nothing other than, it's a screw. Usually it is titanium. Zirconium also is there, but titanium is the most widely used material for implant. We will just screw it into the bone and a crown is placed. You don't have to touch the adjacent teeth. That is the main advantage of this implant. It will just integrate with the bone and will stay there. For full mouth also, like if you don't have any teeth, for older people, if you don't have any teeth, this is one of the best gift, I would say gift you can give for your older generation. Because there is a saying that no one should ever leave your teeth sitting in a glass of water. So that much important it is. Like thinking have changed. Science has advanced, technology has advanced. So it's always better to go for a fixed option. So full mouth can be rehabilitated using implants like this. Next slide, please. Now, coming to I heard few questions coming for implant procedure costly. It's a little costly, but when you compare with other treatment, removable one, you'll have to keep it in, daily you will have to remove it and keep it in water. Then it will be it's a little difficult to use, right? Taking proper hygiene, everything is difficult. But for fixed means it's almost like your normal functioning teeth only. Implant has that privilege, I would say privilege, like you have the privilege of having your own natural, it's almost near natural teeth, or it is a root analog, I would say, rather than implant. It functions exactly like your tooth root. So that is the main importance of implants. Now coming to the oral healthcare for medically compromised individuals, basically oral pain, swelling, dryness, ulcerations, infections, smell, white patches, pigmentation. So these are the main things which we come across when we go to medically compromised patient. Next slide, please. So what are the impacts, oral health impacts, when we see the systemic health? So it's always say that mouth is a mirror to your rest of your body. You might have heard this sentence. So your mouth is more connected to the rest of your body than you think. If you cannot pinpoint the cause of a new symptom, maybe you should check in with your dentist. Many systemic conditions show up in the mouth first. Regular dental exams could help keep your whole body healthy. Next slide. So there are certain health conditions which is connected to your mouth. Dementia. Maybe even if you might have noticed dementia, like if you observe any family member in not only your family member, I'm just talking in general. Okay. Some person might be having a dementia. Sometimes, you know what, you just check your oral hygiene, his or her oral hygiene. It might be poor because they may tend to forget to clean the mouth and all. So that is one thing you can easily find out. Okay. Dementia typically occurs, gradually making it tough for the family and friends to notice the signs in the loved one. One of the noticeable side effects is poor oral hygiene. So it will definitely lead to plaque and it can cause gingivitis. Now, another is heart condition. Gum disease, mostly in heart condition, when heart conditions, there are systemic heart conditions, gum is mostly affected there. So gum diseases has a potential link to heart disease. So irritated or infected gums paired with some other cardiac issues can cause severe problems. So it is always advisable to see a cardiologist, then go to a dentist. Now, another thing is diabetes. I'll tell you a fact that diabetic patients are more prone to gum disease thrice than a normal person, and vice versa. That is, a person who is having a gum disease is 3 times more likely to have diabetes, diabetic issue. If you control the diabetes, gum disease come down, and if you control the gum disease, diabetes also come down. Next slide, please. Now, next is osteoporosis. So because of osteoporosis, there might be receding gums, and it can end up in loose tooth, and you may lose the teeth. And there are some eating disorders and heartburns. Usually Because of these stomach problems, you might get ulcers and all, and there might be regurgitation of gastric fluids, acids and all. You might end up in erosion and severe sensitivity of the teeth, which can be corrected, maybe because of some desensitizing toothpaste and crowns or fillings or whatever. But first you have to correct your systemic condition, then only go to the find out the correct reason, correcting it, and then correcting the dental issues is the thing to be done. Next slide, please. Is gum disease especially dangerous to your body? Maybe, may not be. While some studies have shown that gum disease may be linked to conditions like heart disease, diabetes, stroke, cancer, Alzheimer's, and many more, ADA hasn't made a definite statement like that. So, in a nutshell, what we have to see is we have to brush your teeth twice daily, floss regularly, eat right and limited sugar, especially in drinks, and schedule dental exams regularly and stay vigilant. I would recommend every one of you and those of your loved ones to do a regular dental checkup once in every 6 months, which is mandatory. Thank you.
Okay, next part will be covering by me. I will be discussing about the
Ma'am, oh, just 1 minute. Now, I would like to invite Dr. Fousiya KS for sharing her knowledge and experiences on pediatric dentistry. Dr. Fousiya KS, a passionate pediatric dentist, having a special interest in dental rehabilitation of children, including differently abled children by counseling and comforting touch. She has an experience of assisting and operating more than 20 complete oral rehabilitation cases under general anesthesia. She is an expert in pediatric restorative and endodontic procedure, including preventive and interceptive orthodontic treatments with removable and fixed appliances, minor surgical procedures, and management of dental trauma. Over to Dr. Fousiya. Ma'am, please.
Thank you. Today I am discussing about the child-related oral problems and its general management. So, can I share a slide? Is it visible?
Yes.
Has to close the slide share.
Importance of milk tooth. So importance of milk tooth. We have two sets of dentition. One is milk tooth or primary dentition, and the second one is the permanent dentition. And what are the importance of this milk tooth? They are important as permanent dentition, and the most important function is the aid in chewing and digestion of food, and it helps for the development of speech and growth of upper and lower jaw, aid in smiling and aesthetics, and also help for the psychological development of the child, and it prevents the harmful oral habits, and it helps for the guidance of the eruption of the permanent tooth. In this picture, we can see these are the primary tooths, and the permanent tooth develops just below the primary tooth. So this primary tooth holds the space for the eruption of the permanent tooth. And what will happen in the early loss of milk tooth? So most common cause of the early loss of milk tooth is due to the cavities and injuries. And when early loss of milk tooth happens, this if milk tooth goes early, this adjacent tooth moves to this place. In this picture, we can see that this space is closed, and the permanent tooth will be impacted under this adjacent tooth. And to avoid this, a space maintainer is given. And this space maintainer holds the space for the adjacent.
Ma'am, your slides are not moving, I think so. You can put it in view show, ma'am. View slide.
Ma'am, slide.
Slideshow. You said the cup-like icon you can see at the bottom, third one. Slideshow mode. So it's not moving. It's because the importance of milk tooth.
Now it's moving.
No, not changed. Just click on that. Then you change it and then. Slideshow, resume slideshow. You click on that slide and then you show. Then it will change it. You change that slide and then.
Are you able to see extreme, right down in your slide, there's 68% written. There are 3 icons down.
Ma'am, 3 icons.
Yeah, 3 icons are there near that percentage which is written. The last icon is the slideshow. Click that and this slide will come as a slideshow.
Ma'am, I just done slide sharing.
Or maybe then you are sharing, but it's not appearing for us.
Ma'am, can I share?
Yes.
Okay. Is it visible?
Yes.
Yes.
Okay, now it is changing.
Okay. Next slide. Next one is the late loss of milk tooth. So not all children lose their teeth at the same time. Some children may not start losing their milk tooth until the age of 8 or 9 years. And a child whose teeth erupted at an older age also lose their teeth later. So late loss of primary tooth can be due to malnutrition or vitamin deficiency, and some systemic conditions like hypothyroidism, growth hormone deficiency, and congenital absence of permanent tooth. And sometimes this permanent tooth starts to erupt before the losing the milk tooth, and they will erupt behind the milk tooth. As we can see in this picture, that permanent tooth will erupt behind the milk tooth. And such cases, the extraction of milk tooth is indicated. Next slide. What about infant oral health care? For babies, before the eruption of teeth, wipe the baby gum with a soft, clean cotton cloth after every feed, or morning after first feed and night before bed. So during the teething time, we can massage the gum. And when teeth comes out, start brushing twice daily with a soft bristled toothbrush and a plain water or silicone finger toothbrush. And visit the dentist by baby's first birthday to spot the signs of any initial problems. And for children younger than 2 years, consult with the doctor regarding the use of fluoridated toothpaste. Next slide. And how to brush our teeth? We have to brush all the surfaces of our teeth. That is outer and inner surface. So how to place the brush? That is, place it into a bristle should be placed along the gum line. This is like this, along the gum line, 45-degree angles towards the gum. And bristle should contact both the teeth and gum. And gently brush using up and down strokes and rolling motion. That is, this front part and all, we have to brush up and down motion. That is vertical brushing. This side also up and down motion. And also brush upper and lower front teeth. This is upper front teeth. This is lower front teeth. It's upper and lower front teeth inner surfaces. And for biting surfaces, we have biting surface on lower teeth, and also upper teeth we have biting surfaces. That we can brush by gentle back and forth scrubbing motion. And gently brush the tongue to remove odor producing bacteria. Next slide. And next question is, how much toothpaste is needed? So first, children up to the age of 3 years should we use only tiny amount of toothpaste. That is the smear layer or a size of a rice grain. And children age above 3 years up to 6 years should use a pea-sized amount of toothpaste to clean their teeth. And adult can use up to 2/3 of the length of the toothbrush. And why this is because when children consume a large amount of toothpaste over a time, they may develop dental fluorosis, which may discolor their teeth. So two things should be considered while addressing a child. And one is the amount of toothpaste used. Next is the fluoride concentration in the toothpaste. So fluoride concentration is less for kids, commercially available kids toothpaste compared to the adult fluoridated toothpaste. So better to go for kids toothpaste or limit the amount of toothpaste. So after 6 years, children will learn how to spit properly, and their brushing technique will improve. Then we can go for adult toothpaste. Next slide. Next is the tooth eruption and teething. So tooth eruption timing, the first tooth erupt around 6 months to 1 year of age. And around 2.5 to 3 years, that all primary tooth will erupt. And the permanent tooth erupts around 6 to 7 years, and around 10 to 12 years, all the permanent tooth will be erupted. Not all the primary tooth is replaced. And there's some classic signs of teething problems when the problems the child will have while the eruption of teeth include sore, tender gums, drooling of saliva, child will be so irritable, and that will be biting on some objects, and night walking, crying, and refusal to feed, and some case a slight increase in temperature. So what is the best way to soothe sore gums? One is the rub your baby's gums with clear finger or wet gauze or wet cotton. And we can give babies to bite on something. That is the keep it cool. That is a cold or chilled teething ring or spoon can given to children to bite on that. And some teething medications also there, like pain relieving medications also available. Next slide. This is the teething ring. So how to use this teething ring? We have to keep it in the fridge for some time, then only we have to give to that child. So when they bite on this, they will get some soothing effect. And some analgesic paste also available that can also use. Next slide. And nursing bottle caries. Nursing caries can be due to when your child sleeps with a bottle. So what are the symptoms of this nursing bottle caries? That is, it initially appear as a white spots on the tooth, usually on the labial surface of the front tooth. And early development of cavities can be seen, that is brown areas on the tooth that can due to the tooth destruction. Usually lower front tooth is not involved, only upper tooth and back tooth is involved in case of nursing bottle caries. And how do we prevent nursing bottle caries? so what is we can do, that is begin with a good early mouth care of the gums and the tooth, and don't allow your child to go to bed with bottle filled with milk or sugary liquid. And when your child and wean your child with on a timely manner, not give while sleeping. And begin dentist visit for your child at the age of 1 year. That is, early lesion can be identified when you visit early. So that can be corrected. And next. And diet and its importance. So why do we have cavities? Cavities is caused due to bacteria in the mouth uses the sugar in the food to make acids. And these acids erode the tooth surface and slowly form some holes. That is the cavity. So we can do some diet modifications. So faulty feeding habits can lead to nursing bottle caries, and eating sugary and sticky food leads to caries progression, and drinking low pH liquid can cause tooth erosion. And how to reduce the risk of caries progression? That is by some diet modifications, by reducing sweet and sticky food, eat food with rich in fibers that include more vegetables and fruits, and drinking plenty of water, and rinse mouth after every meal. Next. And coming to dental injuries, and children usually goes for athletic activities and they are more mobile. So fall and dental injuries are common in children. And to prevent dental injuries, wear a custom-made mouth guard that we can use inside mouth while practicing in sports like field hockey, football, wrestling, etc. And so dental injuries can be tooth fracture or tooth displacement injuries, or tooth may come out from the socket, or maybe a root fracture. Next slide. So two types are there. That one is the what to do if your tooth is broken tooth. Like in this picture, it can be broken tooth, or it can be displacement injuries, or tooth may come out from the socket. So in case of broken tooth, find the piece of the tooth piece, and piece can be glued by a dentist into same position. So it depends on the depth of fracture. So maybe enamel fracture, enamel and dentin up to pulp. So treatment varies according to that. According to the level of fracture, treatment can be varied. And what to do if your tooth is knocked out? It is full coming out from the socket. So first step is to find the tooth and hold it in the crown area, not the root, and rinse in a cold tap water. So first we have to find the tooth, and we can rinse it in a cold water. And next slide. If possible, put the tooth back into its place. It is too painful. If child allows, we can just put back into that place, or place the tooth in a cup of milk or salad. So don't keep it dry. It's only carrying tooth carrying media are also, commercial media is also present, like Hans Balance solution, or we can just keep that in a milk or salad. So if the child is, or other option is, if the child is conscious and there is no milk or salad, then we can place the tooth in the mouth between cheeks and gums and seek immediate dental treatment within 2 hours of the visit. So dentist can put back the tooth into place and we will spin it. Next slide. Next is the oral habits. So habits are frequently acquired and that may be harmful to the dental occlusion and supporting structures. Common oral habits includes the mouth breathing, that's breathing through the nose, tongue thrusting, keeping tongue between two upper and lower teeth, and also thumb sucking, lip biting and nail biting. So it's, oral and skeletal changes depend on the it is related to how often these habits are seen and how long it is and how intensity of these habits. First one is the thumb sucking. Why do have some children suck their thumbs? So when we look into babies, babies have a natural rooting and sucking reflexes, which can cause them to put their thumb and fingers into their mouth. And this thumb sucking makes the baby to feel secure, and some babies might eventually develop a habit of thumb sucking when they are need for soothing or going to sleep. What happens is many children stop this sucking habit by their own, or often at the age of 6 or 7 months, or between the age of 2 to 4 years. If the child continues with these habits more after 4 years, or the dental changes like gap between, in these photos we can see a gap between upper and lower tooth, and also the flaring of teeth. In such cases, habit correction is needed. Next slide. And next is the mouth breathing. Mouth breathing is the breathing through the mouth. This can be caused by some medical conditions like allergies, chronic cold, deviation into the nasal septum, enlarged adenoids or tonsils, or polyps in nose, and some birth anomalies. And this mouth breathing can lead to dental problems like poor positioning of the lower jaw and tongue, and irregular bites and long faces, and some extraoral changes like crooked nose, receding chin, narrow and long face, and incompetent lips and smaller airway. So in such cases, speech and swallowing difficulties may be seen, and sleep problems also seen. So treatment of mouth breathing depends on the underlying cause. First is the medical condition should be corrected before the dental treatment. So oral changes can be corrected by habit breaking appliance like oral screen. Next slide. Next is the tongue thrusting, keeping tongue between upper and lower tooth. So it is the habit of putting the tongue in incorrect position, or forward or lateral position. It is usually seen in infantile swallow. So this pattern is exhibited by children from birth. So it is acceptable to have this following pattern up to the age of 4. So when small babies feed, they usually place the tongue forward. So after the age of 4, and if this continue and there is any dental changes like gap between upper and front tooth, such cases, habit correction is needed. Next slide. These are some of the habit breaking appliances. So habit breaking appliance can be removable or fixed, and removable can be taken out by the child, and fixed cannot be taken out. So both appliances are effective for habit correction. So this photo shows the tongue grip appliance. So it helps to position tongue correctly. So it also prevents thumb sucking. When child keep the thumb inside, it will cause some pain or discomfort, and child will discontinue that habit. Next slide. This is the oral screen appliance. This helps to correct the mouth breathing, and also thumb sucking also corrected by this. It can be used for muscle exercises and to improve the muscle tone. Next slide. Next is the myofunctional and orthopedic appliances. So myofunctional appliances remove the, this can be removable and fixed. First one is the removable appliance, second one is the fixed appliance. These appliances lead to both skeletal and dental changes. So it will regulate and change the growth pattern of the individual. First one is the twin block appliances. Next slide. This is the pre and post treatment photo using a twin block appliance. You can just see that initially there is an increased overjet or protrusion of upper teeth. Later it is corrected. And this photo facial profile, lip trap is seen, and there is improvement of lip trap. And jawbone, this lower jaw is more backward positioning earlier. After using this appliance, we can grow, regulate its growth, and it's more forward placed. Next slide. And face mask, some face mask and headgears are the orthopedic appliance. This basis of these appliances, they uses some forces to correct the prevent or improve the position of upper and lower bones. So it can resist the growth of jaws or redirect the direction of the growth. Example is face mask. In this case, you can see some elastic is connected to this upper tooth. So this upper jaw is more inside than lower jaw. Usually upper jaw is little forward. So we give some force using this appliance, and this help to the movement of upper jaw forward. So it can correct anterior prospect, that is, tooth will be like this in such patients, and we can correct using this. It will move the upper jaw forward, and we can correct like this. Next slide. This is the headgear that is opposite for face mask. That is, it will, some cases maxilla will be more, upper jaw will be more protruded. In such cases, we can just prevent the growth of upper jaw. So this appliance will prevent the excess growth of upper jaw and also little retraction of the upper jaw. So what we have to do is, if all these appliances are only given at growing ages, so around 14 to 16 years of age. After that, a surgical correction is needed for such cases. And so early diagnosis of this dental and skeletal changes can be corrected using such appliances. And this can avoid surgical correction. Next slide. So good oral health is not only essential for good overall health, it also affects a person's quality of life and self-esteem and performance at school or work. So
Thank you, ma'am, for sharing your knowledge with us. Next, we can have a doubt clearing session. Participants can post your questions in chat box or can ask directly by unmuting your microphone. Ma'am, we have one question in the chat box. Is it a myth or fact that early teething in infants delay their motor activity? Dr. Ashna and Dr. Fousiya, the question in chat box is it a myth or fact that early teething in infants delay their motor activity?
No. It's not a fact, because early teething means child's overall nutrition and everything is good. Because of that only that child is getting early teething. So that doesn't show any delay in development.
Another question is there any relationship between thyroid disorders and tooth sensitivity?
Yes, thyroid actually has impact on, dental conditions. Like I would say in a broader sense, hypothyroidism and hyperthyroidism. I'll divide it into two. And basically, hypothyroidism usually causes malocclusion, delayed tooth eruption, and poor oral hygiene. And poor oral hygiene, if you just, as I mentioned earlier, if you just keep it like that, there might be a deposition of calculus. It can lead to gum diseases, and severe gum diseases can lead to sensitivity as well as loss of your teeth. That is in regard to hypothyroidism. And regarding hyperthyroidism, there are high chances of caries. The caries will be very, very high when compared to normal persons. And gum diseases are more in case of hyperthyroid people, and there can be chances of burning mouth syndrome, xerostomia and all. I hope it's clear.
Thank you, ma'am. Another question is, can you say specific breath order for any specific diseases? That is, in case of diabetes, if there is any acetone smell in breath, likewise.
Yeah, like in liver conditions or in diabetic, every condition, it is different. So first we have to, first and main thing is you have to visit your dentist and see whether it is due to a dental problem or is it due to some other disease. So basic differentiation should start from there, and then we have to find it out.
Thank you, ma'am.
Remember, so many are telling that they are able to unmute. Jaya ma'am is there, Jaya Kumari ma'am is there. She want to.
I can see a few questions in the chat box. Like, could you please share your opinion on dental implants for people who have poor gums or bones? What are the options for such people who are 80 plus? That's a good question, because I told you, like before and all, for full mouth rehabilitation, we just had one option, that is removable set of one upper and lower dentures. But nowadays, even for age doesn't matter. It's not the age actually matters. Let it be 80 or 90 or whatever. What matters when it comes to an implant therapy is the quality and quantity of the bone. So if the quality and quantity of the bone is good enough, we can go to implant therapy. And if good osseointegration can be achieved, that is quite well, actually. And in certain conditions, if the quality of the bone is not good enough, then you have to go for a removable option. Still, options are there. It's that you cannot go for a fixed option, then you can go for a removable option. We have options. Yeah, and another question is like the problem for ladies after the age of 50. Yeah, of course, because of age-related issues. Even for ladies also, otherwise for both the gender also, after 50 years, there are high chances of having gum problems more than decay issues. Because of hormonal issues also, there are high chances of maybe like xerostomia and other gum diseases are quite common. So first you have to visit it. That is why I told you, you have to visit your dentist every 6 months. And so many things can be ruled out. If it is a medical issue, we can just, many of times, people come to a dentist not knowing their medical issues just for a dental treatment. And from there, we will diagnose it from there and will send to a physician. Many times it happens. So it's always better to have a review.
Madam, there are a few more questions in chat box.
Yes. What should be done for improving gum or bone quality? Any specific diet? Ideally speaking, the food which is rich in calcium as well as vitamin C, it's always better to have improved gum and bone quality. Antioxidants also plays a good role. Those who cannot unmute, you can just type your questions on the chat box. There is another question. What precautions are to be taken if FLR is done? You meant post-orthodontic treatment, right? So the cleaning should be proper. That is the main thing you have to take care. Brushing and everything has to be taken care of properly. Another question, even after brushing twice in a day and flossing, deposition of calculus comes in between months after scaling. What may be the reason? How can it be corrected permanently? Okay, so maybe the method of brushing or flossing may be a problem. If you have a very tight contact, again, flossing may not be proper. Or if there is any bone loss, you can use this alternative, that is interdental brushes. So interdental brushes are available in the market. In between two teeth, you can just clear it off. And maybe some problem with the technique also can be a problem. And for some people now, after scaling, it varies from person to person. Like for some people, deposits come back very frequently. For some people, maybe it delays a lot. It varies from person to person. So every 6 months, you can have a review. And if you feel like calculus is forming very fast, maybe you can cut short the 6 months to maybe 5 months or something like that and do a professional scaling. There is no harm. And it's always a fallacy that cleaning your teeth using ultrasound scalers can remove your enamel. No, never. Because it's basically ultrasonic vibrations, not a cutting using a burr or something. It's entirely different thing. So it's a myth. Scaling never loses your enamel. That is only the calculus portion which is adherent to the teeth, which is going. You don't have to worry about that. Clear and aligner therapy, it starts from basically from 60,000 onwards. Basically, it's a set of trays. It depends upon the number of trays you use. Like for some people, it may be 10 trays. For some people, it may be 20. For some, maybe 30 or more. So depending upon the number of trays is the expense. And it depends upon the various companies also. There is something called Invisalign. Clear aligners, there are so many companies. Invisalign is the best one available. So that will be quite expensive also.
Good morning, madam. I am Kala. I have a little bit doubt. Madam, fluorosis is very common these days in coastal area, especially in coastal area. But most of the doctors, they prescribed fluoride-containing toothpaste. Is it advisable, madam?
Dr. Fousiya can help you.
So, fluoride-containing toothpaste have usually topical application. Fluorosis is due to a systemic action. When we ingest fluoride, that will go to our blood and come and deposit in our bone and teeth. It causes fluorosis. So fluoride-containing toothpaste, we can spit and we can wash our mouth. It's about usually available fluoridated toothpaste contain 1000 to 1200 ppm fluoride. So properly wash your mouth and all, we will not use the fluoridated toothpaste. So because of that only, that kids' toothpaste amount is limited. Up to 3 years, we have to give only smear layer, and 3 to 6 years pea size. Because when we learn to spit with fluoridated toothpaste, we can use that. It have only a topical application effect, no systemic application. Fluorosis is mainly due to a systemic fluoride content. Is it clear?
Okay, madam. Okay. Thank you.
Madam, one more question. It is common that children or most of the people is having gummy smile. In your opinion, at what age it should be given proper attention or the process should be done, gum correction?
Any surgical correction should be done after 18 years or all the permanent tooth after the eruption of all the permanent tooth. And initially we will have some ugly duckling stage when the canine tooth erupts, tooth will move distally and some spacing will be there. So it is normal. If anything there related to orthodontic, like severe protrusion or this gummy smell or with placing some crowns or veneers, everything should be done after 18 years or eruption of all the permanent tooth.
Thank you, ma'am. Any more questions from the participants? Madam, there is a question in chat box. For children, how much fluoride is normally recommended in toothpaste?
So also say, in children we can give adult toothpaste, but limit the amount of toothpaste. So like smear layer or pea size. Or if the child know how to speak properly, then we can use adult toothpaste. In commercially available child toothpaste usually contain 450 ppm of fluoride. So adult toothpaste around 1000 to 1200 ppm. So half of the fluoride is usually seen in kids toothpaste. So we can just limit the fluoride by amount and take in the kids toothpaste. Then fluoride is important because this fluoride will help to remineralize initial caries. That is because of that only we are giving topical application through fluoride varnish or toothpaste. Toothpaste we use every day, so we will just apply on the tooth surface. It helps for the remineralization of the initial caries. So it basically prevents caries. So there is no amount of fluoride in toothpaste. Just limit the amount of toothpaste. That's important.
Okay, I think only that much questions from the participants. Now I request Mrs. Gladys P. Kachapalli for delivering the vote of thanks.
Ma'am, am I audible?
Yes, ma'am.
The distinguished guest of honor, delegates and participants, a very good afternoon to one and all. It's a great honor and privilege to propose the vote of thanks for this national webinar on the topic Shining Teeth for Smiling Face, organized by Indian Pharmacy Graduate Association Women's Forum, Kerala branch. On behalf of organizing committee, I convey my regards and heartfelt thanks to the Indian Pharmacy Graduate Association Women's Forum. I would like to thank our beloved IPGA Kerala State President, Dr. Satish Kumar Manan, for his constant help and guidance that radiated a source of energy within us. We will ever remain grateful to you. Thank you very much for your esteemed presence, sir. I'm rather very glad to thank our very honored and renowned guest, Dr. Sanju Devan, Director of Research and Development, Doctors Pharmaceuticals, Ahmedabad. Thank you very much, ma'am, for letting us have your valuable time and active participation in this session. Every tooth in a man's head is more valuable than a diamond. I express my sincere thanks to the speakers of this session, Dr. Fousiya and Dr. Ashna. My sincere thanks to Dr. Ashna B for finding time to grace this occasion by giving a good overview of the topic and making the session very interesting. Slides were very attractive, and I appreciate your sincere efforts to explain how we can improve our tooth care in day-to-day life. We are also grateful for the time and effort it took to share your views and experiences in this program. Once again, thank you, Madam, for being with us. Thank you, Dr. Fousiya, for the excellent presentation on the topic of pediatric dental care. Really appreciating your professional expertise in pediatric dentistry and for imparting important tips to protect smiling faces of our little ones. On behalf of IPGA Women's Forum Kerala, I express my sincere thanks, Madam. I express my sincere gratitude to the energetic and enthusiastic IPGA Women's Forum Coordinator Kerala State Branch, Dr. Mahalakshmi R, and all the team members who stood by us to make this event a grand success. A special mention to Remy Gayatri, Assistant Professor, Department of Pharmacy Practice, Chemist College of Pharmaceutical Science and Research, and IPGA Life Member for moderating this session in a nice way and making it a wonderful one. I am grateful to Dr. Limsi Thambi, Professor and Head, Department of Pharmaceutics, Chemist College of Pharmaceutical Science and Research, a member of IPGA Women's Forum Kerala branch, for her sincere efforts to make this program a great success and for delivering an incredible welcoming interest. A warm thanks to the energetic, encouraging, and motivating Secretary of IPGA Kerala branch, our Dilip sir, for his involvement and sincere efforts for the successful completion of this session. We are really thankful to you, sir. Next, I take this opportunity to convey my heartfelt gratitude to Dr. Nishit MC, Drugs Inspector Malappuram, and an executive member of IPGA for backing us with all the necessary technical assistance. And my special thanks to Matthew Kukad, sir, Senior Industrial Pharmacist of Kerala. Then Dr. Jayagumari, IPGA Women's Forum Coordinator, Tamil Nadu, Professor Kanchan Holly, Convener, IPGA Women's Forum, and all the participants of different states for making this a valuable session. I take this opportunity to give glory to the Almighty for making this webinar a grand success. Once again, I would like to express my gratitude to all the esteemed delegates of the webinar for their presence and contribution to make this webinar a great success. Thank you, one and all.
Thank you all for joining us.
Any Kanchan ma'am, possible, everyone want to see you. Possible, you may come on video. Is good to meet everyone. Ma'am, I think she's there. Isn't it, ma'am? Kanchan ma'am.
Hello.
Yes, ma'am.
Am I audible?
Yes,
Yeah. So, congratulating you all team members for organizing such a wonderful program on national tooth problems, and that's really day-to-day problems which we are facing, and might be our children, grandchildren, they are facing the same problem. So, thank you, Kerala Women Forum team, and Professor Sanju Dhawan for the coordinator of this program. And I'm really thankful to all of you to organizing such a wonderful program. And I hope in future also you will be organizing such wonderful programs. And with all wishes, thank you all.
thank you, ma'am. Thank you very much. Ma'am, we can wind up this session. Okay, thank you very much once again, Dr. Ashna and Dr. Fousiya, Sanju ma'am, everyone. Okay, ma'am, we can wind up this session.
Thank you all.
The audio is not there, ma'am. I think we can stand and we can sing. That is better. Everyone, please for national anthem because the audio is not working.
Okay. Call cut ചെയ്യല്ലേ?
Yes, we can wait.
Okay. End ചെയ്യാണ്.
Okay. Thank you.
Thank you all.